Let's talk about the posterior compartment of the leg. You can see there's a cross section, and this is what you're looking at, the anterior compartment, the lateral compartment. A huge bulk which is formed by this posterior compartment, and we can see in this image, skin has been removed and you can see the lower thigh and the whole leg and the foot, and there you can see this muscle has been removed. So we are looking at the posterior leg muscles, and these muscles we'll be learning in two layers, a superficial layer and a deep layer. Different authors believe in different ways of learning. Some people believe in superficial, intermediate and deep layers, and some people believe only in superficial and deep. None of them is wrong. So let's talk about. So this is where my posterior compartment is located. You can see the bulk of my leg is made by this posterior compartment group of muscles. So now what I'm showing you a place where these posterior compartment group of muscles, they become this tendon that is called tendocalcaneus or tendoachilles, and this tendon may rupture in different sport injuries. And can you see a tiny tendon going side by? It may blend with this tendocalcaneus or it may go separately. This is the tendon of my plantaris muscle. So if these tendons rupture, we can hear a pop sound, and this is a severe, very painful. And who are the people who are affected? Those who are playing basketball, squash and high jumping. And when this tendon ruptures, especially the plantaris, there is an excruciating pain, and is a small, but pain is a lot. And this long cylinder tendon, it is also been used for various reconstructive procedures, and this muscle may be present in certain individuals, so that's not a big deal. Now let's look at the first muscle, who is located in the superficial layer muscle groups, and that muscle is my gastrocnemius muscle. You can see that this muscle comes in two heads, a lateral and a medial head. This one is the medial head, this one is the lateral head, and then it becomes one belly, and then it transforms into a tendon, which is tendocalcaneus, because it's going to the calcaneum bone, which is one of the tarsal. It's going down. It is also known as tendoachilles, and I've talked about in the previous slide that this tendon may rupture in certain sports-related injuries. Proximally, this muscle, the lateral head comes from the lateral condyle of the femur, and the medial head comes from the popliteal surface of the femur and superior to the medial condyle. And then distally, it becomes a tendon, and it goes to be attached to the tendocalcaneus. The posterior compartment group of muscles, what they do, they are the plantar flexor of the foot, and they are also inverters of my foot at the subtalar joint. And the nerve who controls these muscles, that is my tibial nerve. Look, we can elicit. If we have to elicit S1 and S2, we can tap here with the help of this hammer, and that will tell us what are we looking at, the spinal segment. So the ankle reflexes can be recorded, and we are testing for the S1 level of the spinal cord. So once we are evaluating the neurological deficits and the recovery, so we are doing this type of examination. And Achilles tendon is one of the very strong and the largest, and it carries 500 kg of gradual loading. It's not like you put suddenly 500 kilogram and it can withstand. So it is that strong that it carries this much big weight, but if it's been given slowly and slowly. The second group muscle is a very tiny one. You can see this very small one with a very long tendon. This is my plantaris muscle. This plantaris, from where it's coming, inferior end of my lateral supracondylar line of the femur and oblique popliteal ligament. These are the two locations from where this muscle coming, and it becomes into a tendon, and this tendon goes all the way. It can be attached to the calcaneum bone separately, or it may blend with my tendocalcaneus. And this is a weak plantar flexor and a weak flexor of the knee and it may be absent. But as I mentioned earlier, we use this tendon for various harvesting. If, let's say, someone has broken, there's an injury in the hand, and we need to replace that broken tendon. So this Plantaris is one of the very nice candidate from where we can find a very good, very strong tendon, and this tendon can be used as a replacement of the ruptured or the broken tendon, specifically in the hand surgeries. And this muscle is also controlled by the tibial nerve. Now, we talked about this injury here, and this injury, it's a really painful injury. And then the last muscle of my superficial group of muscle, look at it, this looks like a fish. We call it Soleus muscle, and it forms the bulk of my calf. And this muscle, proximally, it's coming from where posterior aspect of the head of the fibula, soleal line, and middle third of my medial border of the tibia. So these are various locations from where this muscle is attached proximally, and distally they all become tendocalcaneus, and that goes to be attached to the calcaneal bone. And this is a plantar flexor of my foot. It's a major flexor, and then it's controlled by the tibial nerve. And then again we talk about this, so I'm not talking again. And this is the table which covers the superficial group muscles who are located in my posterior compartment. We have talked about all these, and this is a summary. Now let's talk about the deep layer muscles. And first muscle, it looks very small, but it's a very important muscle, and this muscle is known as the popliteus muscle. This popliteus muscle proximally is attached to the lateral surface of the lateral condyle of femur, and lateral it goes to the lateral meniscus, and distally posterior surface of the tibia, superior to the soleal line. So it's coming from here and going all the way down. And this muscle stabilizes the knee, assists with lateral rotation of femur. So unlocking is depending on this muscle. The unlocking mechanism at my knee, it's primarily part of my popliteus muscle, and this muscle is also controlled by tibial nerve. If tibial nerve sustain an injury, the unlocking at the knee joint will become a problematic thing, and it's really a disaster. Then we are looking at the second muscle. Who's that muscle? That is going to my big toe. This must be a flexor, so, and coming from the fibula. So this is my flexor hallucis longus muscle. You can see that it's going to my distal phalanx, and it's coming from the fibula. So proximally inferior 2/3 of the fibula and inferior part of the interosseous membrane, and is attached base of the distal phalanx of the great toe. It flexes my big toe, and this is also controlled by the tibial nerve. Going further, the third muscle, that is my flexor digitorum longus muscle. You can see that it's present on the medial side, and it changed to the lateral side. That's why some authors say it's a dishonest type of muscle. It's coming down, it turns out to a tendon, a very thin one, and then it splits into 4 tendon for the 4 digits. And this is my flexor digitorum longus. Proximally medial part of the posterior surface of my tibia, inferior to the soleal line. This is the soleal line, and then it becomes a tendon, also soleal line, and there's a tendon which is coming from the fibula. So this is how it's coming from these two sources, and then it's going to attach to the base of my distal phalanges of my 4 digits. And what it does, it flexes the lateral 4 toes and assists with plantar flexion. And this muscle is also innervated by tibial nerve. Now we are looking at the last muscle, who is the one of the deep muscle of my posterior leg, and this muscle is tibialis posterior muscle. You can see it's coming from the interosseous membrane, posterior surface of the tibia, inferior to the soleal line, and posterior surface of the fibula. So many attachments. A huge muscle becomes a tendon. It's coming from the lateral side but ending on the medial side. So it's changing its direction. Quite deceiving here. And distally is attached where? Tuberosity of the navicular, cuneiform, cuboid, and sustenaculum tali of the calcaneus bone of the second, third, and fourth metatarsal. So it has so many distal attachments. And this muscle, it inverts where at subtalar and plantar flex where at ankle joint, and it's a dynamic support. Which side? It's a dynamic support for my arches. And it is also innervated by tibial nerve. And this table explains all these muscles, what we have learned so far. And now we can see the arteries and the nerves who are responsible to control these muscles. We are looking at the tibial nerve, and then we are looking at the posterior interosseous artery, and you can also see the fibular artery, which is a branch from my posterior tibial artery. And there you can see this is the popliteal artery, which becomes anterior tibial, which pierces this interosseous membrane going to the front, supplying the anterior compartment, and the posterior compartment is controlled by posterior tibial artery, and the lateral compartment is a branch from my posterior tibial, that is the fibular artery. So this is how we get the blood supply and the nerve supply. Nerve supply we have already talked about. The common fibular gives deep and superficial. Deep for my anterior compartment, superficial for my lateral compartment, and the tibial nerve is for my posterior compartment. And then we are looking at the cutaneous branches, cutaneous nerves, who are supplying front, back, and sides of my leg. And now we can see a very important factor, the relationship on the medial side of this, what you are looking at. This is my flexor retinaculum, and we are looking at the posterior medial view. This is my big toe, and look at it, so many tendons. How we can identify? So we can see that this is my tibialis posterior, and then what we are looking at, the flexor digitorum longus. There are these vessels. What are these vessels? Posterior tibial artery and the vein. And then this is my tibial nerve, and this last one is my flexor hallucis longus muscle tendon, and then this is my tendocalcaneus. So this is the relationship on the medial aspect of my ankle from anterior to posterior, and this is where we can go for the pulsation of my posterior tibial artery. Is also like we were feeling dorsalis pedis here, and we were feeling for posterior tibial artery at this location. And then there is a mnemonic how to memorize these things. Let's summarize. Posterior compartment, what are they doing? They are plantar flexor and inverters at different joints. Their nerve is tibial. They are controlled by posterior tibial artery, and then we learn them in two layers, superficial and deep. And now this is the popliteal fossa. So what we can see, distally we have the two heads of the gastrocnemius, and proximally, medially we have semitendinosus and membranosus, and laterally what do we have? We have the biceps femoris. So we are looking at the semitendinosus, semimembranosus, and there is a biceps femoris, and these are the contents. And then what we need to know, the location, it's a diamond shaped space, the roof, floor, and what are the contents? We have posterior, we have the tibial artery, popliteal artery, and the popliteal vein, and then we have the tibial and common fibular nerves. They are the contents, and then there are certain lymph nodes. Now what are you looking at on this surface of the leg? You can see these dilated structures. These are nothing but the dilated tortuous veins. These are the varicose veins. And what happens? Those who have prolonged standing, this is a normal pattern. Our veins have valves. So these valves, once they are distorted, so then what happens? The blood start pooling here, and blood start pumped to the superficial veins. So superficial vein becomes dilated, and under the leg we can see these dilated veins, and this condition is a very clinically relevant condition, and these are the varicose veins, and if they are untreated they lead to ulcer formation, and then it worsens the quality of life. Thank you very much.